Food and Drug Administration, as you probably know, has unveiled a new food pyramid.
So some health experts say it finally tackles ultra-processed foods and encourages Americans to eat real whole foods. Others say that some of the recommendations don't match current nutrition research.
Joining us to explain the guidelines is our KSTP medical expert, Dr. Archelle Georgiou. It's nice to see you as always.
Good morning.
All right, let's talk about the new food pyramid and kind of some of the changes that we saw with this thing.
Sure. So they really made a lot of progress, but not as much as we'd like. So there's always positives and room to grow. So let's compare where we were and where we are today. So actually, you know, we haven't had a food pyramid since 2011. We've had a food plate, and you know, the visual is really less important. But since 2011, the recommendations really focused on eating higher grains. It was supposed to be 50% of your intake and lean protein. Let's transition to what we have today, the 2026 food pyramid. This time, the real focus is on whole grains, not just all grains, and there's a lot more protein. They're referring to it as nutrient dense because we know that protein keeps you fuller for longer.
And this is something that a lot of people have really been pushing for, right? Because that's kind of the way, whatever the Mediterranean diet, like whatever it might be,
Sure.
As a population, we've really been shifting toward protein.
Well, I'm going to correct that just a little bit and say that we have been pushing toward a different set of recommendations nutritionally because we know, you know, what's the whole goal of these dietary guidelines? The goal is to summarize the science, to tell people what the science says about how to lead the longest, healthiest life with the lowest risk of a chronic illness. It's not telling you what to do, it's just telling you what the science says. And we know that the Mediterranean diet and the DASH diet, which focus on whole grains, lean meats, fruits and vegetables, legumes, they are associated with the greatest longevity. So there are many parts of the new food pyramid that reflect that. Not all, but we made progress. So let's look at, you know, people think about serving sizes. So let's talk about that. The biggest changes are at the top of this chart. So on protein, the old recommendations were have about 5.5 ounces a day. Now it's between 9 and 12 ounces. Yes.
Twice as much.
It's about twice as much. And there's not a lot of pushback on that. The pushback is the fact that they're not saying to eat lean protein. Right? And so that's a question. The other area is that they did decrease the amount of grains that they're recommending down to 2 to 4 servings per day as opposed to 6 servings per day. And then the fat recommendation decreased a little bit from about 6 teaspoons to 4 to 5 teaspoons. But I do want to highlight that there's so much more fat in the other categories because they're not recommending lean meats. They're recommending full fat milk as opposed to low fat milk. So there's fat in other areas of the diet.
Well, and interesting because the fruits and the vegetable servings
are all the same. They're all the same.
Huh.
Yes.
Okay.
So it's the ultra processed meats that are having some people be concerned about versus, you know, a nice chunk of salmon versus a pound of hamburger or whatever it might be.
Right. So they're definitely not recommending eating protein in the form of prepared food, frozen foods, you know, fish sticks, all of those ultra processed foods, really sticking with whole foods, real foods. And the biggest category that's going to affect people in that everybody's applauding is have fewer processed grains, breakfast foods, frozen foods, white bread, flour tortillas, all of those snacks. I mean, they're really recommending that people avoid those and instead have whole grains, as well as the fruits and vegetables that go along with that.
I feel like all the things that became really popular in the 80s, you know what I mean, to make everyone's life easier, all the things we grew up eating.
Absolutely. So this new food pyramid, you know, as you could see, it's not like the proportions are that different, except for protein. It's really the quality of the food that's different. That's really the big thematic change across all categories.
Okay, one of the things they didn't look at in this, which I always talk with our family about, is the salt intake. My kids love to grab the salt shaker and salt before they even taste anything. And I'm like, put that down, let's take a bite first. But that's something that wasn't addressed.
Actually, it was addressed, but not in the right direction. Okay. So in the recommendations, it said, use salt, spices, and herbs to flavor your foods as needed. That's a very different recommendation from the past, which suggested that you should avoid salt. So we know that salt is associated with hypertension. A lot of people have hypertension, undiagnosed hypertension. So the fact that they didn't create caution around using that salt shaker was a deviation from what we know affects people's health and heart disease.
Well, and I heard too, like alcohol wasn't really addressed in this.
I have to tell you guys, so I have read recommendations, you know, the American Heart Association, the American College of Lifestyle Medicine, and others have written commentary back to RFK Jr. and the FDA about their opinion on these guidelines. They've said a lot of what we've just talked about. What people are not talking about, and I'm going to question it, is they're not pushing back on the change in alcohol recommendations. I think it's such a sensitive area for us. So let's talk about what they were and what they are. They were no more than 2 drinks a day for men, no more than 1 drink a day for women, and they put some parameters around it. That has changed, and now they're just saying, drink less. Well, what does that mean? And you know, Dr. Oz said that alcohol is a social lubricant, which can be true, but we know that alcohol is associated with so many diseases, including the Surgeon General's report that came out last year that said that alcohol is associated with many different types of cancer. We see so many people with liver disease, cardiovascular disease, et cetera. So putting no serving size recommendation around alcohol could be dangerous and could be misleading to people thinking that, well, I don't need to follow these guidelines anymore.
The alcohol thing is confusing, I think, for people because it's like every day you'll read some study about 2 glasses of wine and, you know.
Red wine is good for you.
Red wine's good for you.
Yeah.
And
I think those are dated. The newest recommendations, there is no question and there's no controversy that alcohol is related to many different types of conditions, including many different types of cancer. So we want to remember the red wine is good for you,
As
the
you're
drink
enjoying a
it,
glass.
the resveratrol. Those are dated. And that doesn't mean you don't have to drink anything, but don't create the perception that a lot is good. A little is fine.
And you think
a
by
lot is
mentioning
not
it in the food period pyramid that does.
Yes.
Yeah, I mean, I definitely get your perspective on that.
How are doctors handling this? I'm kind of curious how doctors are kind of addressing this with their patients who come in and have questions about it too, right? I mean, you've got the FDA coming out and saying one thing, and an RFK, and then as a patient, I might come into you and say, well, what do you do? Do doctors have kind of different recommendations on it?
I mean, it's still a little early. They're only a week old, and all of the science that backs this up is not currently available. You know, the old guidelines were about 160 pages. These are about 10. So there's just a lot less science, and I think doctors are probably waiting for the backup. But I think doctors are going to follow the science, and they're going to say, absolutely, eat fewer ultra-processed foods. Hooray for that. But let's talk about how to limit your alcohol, how to make sure that your blood pressure stays under control, use less salt. I think doctors are going to pick and choose the facts, the parts of it that are supported by science.
Sure. Well, I keep falling back to the protein thing because, I mean, who really is going to look at the food pyramid and say, this is exactly how I'm going to live my life? You know, it just doesn't work that way. But for them to bump the protein up that high and make it that noticeable, I mean, I think to me that's the one that is really going to change.
Yes. And, you know, although there could be even more science to support that one, not a lot of people are pushing back against the protein recommendation. And I'll tell you why. It's that the other recommendation, which was about half the amount that we're seeing today, was based on how much protein do you need to prevent a deficiency. That's very different than how much protein do you need for growth, for healing, for aging. And these amounts, science shows, are much more in line with growth, aging, healing, all of those things. And so not a lot of pushback on the protein category. But there is pushback on whether or not we should still focus on lean meats rather than high-fat meats, red meat, which we know is linked to cardiovascular disease, diabetes, high cholesterol, all those other issues.
It tastes so good, though.
Which is what my family would like to eat every night.
Isn't it a good ribeye?
It's just so delicious, Archelle. Thank you.
I agree. Thank you.
For more medical news and how it impacts you and your life, your body, you can check out Dr. Georgiou's podcast. It's called Speak Up for Your Health. We'll post a link to episodes on MinnesotaLive.com.